Welcome to American Heart Association TV. We're here with Dr. Penny Chris Etherton, who is the incoming chair to our National Nutrition Committee, and she's also a distinguished professor of nutrition at Penn State University. Dr. Chris Etherton, great to see you. Thank you for joining us.
Thank you for having me.
Sure. Now let's jump right into this because we've seen a lot of information in the news lately about a healthy diet, and it's created some confusion for folks sitting at home wondering what to eat. So what would you recommend them? What diet should they follow for healthy living?
Well, there's a lot of evidence for food-based recommendations to decrease risk of heart disease. And foods that people should emphasize are fruits and vegetables, whole grains, seafood, in particular fatty fish about twice a week, low-fat dairy products, and lean proteins. And in addition, nuts, seeds, and legumes are recommended as well. And then there are foods that we should limit, and we should watch our sodium intake, watch added sugar intake, as well as saturated fat.
Now let's talk about saturated fat for just a minute because that's been in the news quite a bit. Why is there this controversy or divergence of opinions on the role of saturated fat in a healthy diet?
Well, there was a recent observational study that was conducted, and it basically showed that saturated fat was not associated with increased risk of heart disease. But people have to be aware of some of the limitations of observational research and also of this particular study. Now, just focusing on this particular study, the authors left out some very, very key studies and then actually transcribed some numbers incorrectly from original studies. But be that as it may, there are some other observational studies out there that don't show an association between saturated fat and coronary heart disease risk. Observational studies basically point out associations that exist, and they can't tell us much about cause and effect relationships. In contrast, controlled clinical studies are designed to test causal relationships, and many, many studies have been done looking at the effect of saturated fat on LDL cholesterol. And there's no doubt whatsoever that saturated fat increases LDL cholesterol. And that increase in LDL cholesterol increases risk of heart disease. And that's the basis for current recommendations to decrease saturated fat, to decrease LDL cholesterol, the bad cholesterol, and in turn, decrease risk of heart disease.
Any argument, any side can point to studies that support their position, but where is the largest body of scientific data? It's not just the Heart Association that's talking about this, right? There are other organizations and other studies that support what we talk about.
Absolutely. Just very consistently, there are recommendations to decrease saturated fat worldwide to decrease risk of heart disease. And we know that WHO, FAO, the International Atherosclerosis Society, and even in the United States, the Dietary Guidelines for Americans that have been written since 1980 have consistently told people to decrease saturated fat to decrease risk of heart disease.
Now, we have our guidelines on saturated fat, on sugar, on sodium, but I think for a lot of consumers or families at home, it can be difficult to remember all the numbers, how many grams they need and how that fits into the diet. So what's a good way to simplify it? How would you recommend families and mothers and fathers looking to do the grocery shopping for their families remember all these numbers?
There's a very simple way to eat a healthy diet to decrease risk of heart disease, and specifically follow food-based recommendations made by the American Heart Association. Build a diet that's rich in fruits and vegetables, whole grains, seafood, low-fat dairy products, and lean proteins. In addition, include some nuts, seeds, and legumes. And, of course, watch out for too much sodium, too much added sugar, and saturated fat.
Well, I think that's a lot of great information, and hopefully it will help families cut through some of the confusion. I want to thank you for joining us, and for those of you still hungry for more information, please visit www.heart.org, keyword nutrition.